Good day everyone. We are from Group C. We'll be presenting about vocal cord polyp. This is a scenario we may encounter in clinic. Ali presented to clinic complaining of hoarseness of voice. Upon examination, he was discovered to have vocal cord polyp on his right vocal cord. So now, let's learn more about vocal cord polyp. What's vocal cord polyp? It is a benign lesion developed in response to vocal fold irritation in anterior one-third of the vocal fold. It is larger and more protuberant than nodules and have more dominant surface blood vessels. Vocal cord polyp is also the chronic form of phonotrauma due to vocal cord misuse or abuse causing rupture of vessels. These are the findings that we may encounter during vocal cords examinations. In this case, there is a spherical lesion at the junction of anterior one-third of left vocal fold. Polyp is usually unilateral. Vocal cord polyp is the most common benign lesion of the vocal cords. The peak incidence usually from 30 years old to 50 years old. Children and adults are equally affected.
This is how it looks like on an indirect laryngoscopy. The etiologies and risk factors include voice misuse or voice abuse. An example of voice misuse is a female who is trying to imitate the voice of a male, while voice abuse usually happens in teachers and professional singers since they have to use their voice in a longer time without having to rest. Next are those who smoke and those who have gastroesophageal reflux disease. Moving on to the clinical features of vocal cord polyp, it includes the changes of phonation, which can cause hoarseness of voice, whispery voice, or even low-pitched voice. However, if the polyp is too large, it can cause dyspnea, diplophonia, and stridor. A vocal cord polyp is diagnosed by using microlaryngoscopy. However, stroboscopy can also be done, but it is not necessary, in which it acts as a complementary test. Biopsy can also be done.
Primarily, vocal cord polyps are treated conservatively through behavioral modification, which is the avoidance of cause, such as voice misuse or abuse, which usually occurs in teachers or professional singers. However, if it is not resolved through conservative management, a surgery known as endolaryngeal microsurgery can be done to resect the polyp. Voice therapy can also be done as an adjunct after surgery for the purpose of teaching how to use your vocal cords properly, as well as how to prevent reoccurrence in the future. So how would we prevent it from occurring? Voice hygiene is a good way to prevent it. We should always ensure good hydration, have adequate voice rest, breathing exercises, as well as healthy diet. We should not yell or speak for a long period of time, as it could cause stress, in turn leading to bleeding of the vocal cord. Lastly, caffeinated and carbonated drinks should also be avoided. Lastly, we would like to end our presentation with some take-home messages. Vocal cord polyps are non-cancerous growth or lumps. It is most common due to voice misuse or abuse. Vocal hygiene is also a very important step to prevent vocal cord polyps.